This
I'm
conference will now be recorded.
I'm a principal scientist of the Boditech Med and also marketing manager. Today, I'm going to present a new product, COVID-19 antigen and flu combo, and I will shortly introduce additional items which is already available or available soon. So I'm going to start with a brief introduction of the Boditech Med. As you may know, Boditech Med is the headquarters is based at Korea, and we have 7 subsidiary companies. And currently, we are distributing more than 120 countries. And employees at the Boditech Med headquarters is around 350, and additional 100 employees are working over the world. And by end of the 2019, we installed around 50,000 devices over the world. And due to COVID situation, this year we installed so far around 8 to 9,000 devices, and we expecting 10,000 devices will be installed end of this year, and totally 60,000 devices is expected to installed over the world. And cartridge production or normal capacity is around 80 million tests per year. But due to a heavy demand for the COVID testing, we are continuously increasing our production capacity. So by next year, probably we will reach 100 million cartridge production per year. And as you may know, our company is very greatly valued on the quality system. And also we have been certified from the CE, KFDA, and Brazil Anvisa and other certificate. This is just the total our product line, including 8 devices and around 55 different markers. It is not marked for the antigen for COVID and antibody COVID. So we will producing more lines for the COVID-19 product. So now I'm gonna start with the COVID-19 combo and neutralizing antibody test. So briefly start with the coronavirus, which have 7 different subspecies. And coronavirus, normally 4 different coronavirus subtype cause just a common cold, while SARS, MERS, and SARS-CoV-2 caused a very serious disease. And this year, SARS-CoV-2 is the pandemic situation all over the world, and we are greatly affected our life and all business and all environment. Normally, coronavirus is consist of the virus shelled with the nucleic acid protein and spike protein, and RNA is the genetic material and reside inside. So these are 7 strains, and they are all close relatives, and especially SARS-CoV or SARS is a very high relationship with the SARS-CoV-2, and they share the common pathway and share most of these features. This is the comparison table. What is more important is about the spreading ability and the mortality. Among these, the common coronavirus is not giving any mortalities in the most of cases. Meanwhile, in the MERS, it is just a local disease around the Arabia area, and it is around 34% of the mortality, which means that 1 out of 3 patients can die. So it is greatly high mortality compared to any other disease. And meanwhile, SARS, which has been spread 2003, is showing the mortality around 10%. So still high. Compared with this disease, the flu or influenza A and B normally giving less than 1% of letalities. Meanwhile, COVID-19 giving 1 to 10% of the mortality. So far, around 60 million people has been impacted and around 1.4 mortality in total. But in initial stage of the COVID-19, mortality was as high as 10%. The symptoms of the coronavirus is very similar to the flu: fever, dry cough, mild breath difficulties, and gastrointestinal issues such as diarrhea and stomach pains or vomiting, which is found in the children, and also muscle pain is another symptoms. With the or severe symptoms, high fever, pneumonia, kidney failure has been reported. At the same time, thrombosis, the aggregation of the blood, which is reported, and that causes a cardiac problem, and also neuronal damage has been reported. Especially in young children, the Kawasaki-like disease, so-called multi-system inflammatory syndrome, has been reported, which affect recovered patient, especially younger persons. Meanwhile, influenza virus has a long history. First known influenza pandemic was the early 20th century, the Spanish flu, which is the name with Spain, but actually it's thought to be originated from the US and then spread through the US armies when the First World War has happened. And influenza cases, there are 4 different types of the viruses exist. What we're familiar with is the A and B, and C and D is the mainly infecting animals. Especially D is no report that human has been infected by influenza D. Especially influenza A virus is causing epidemic or pandemic, and B virus could impacted after or before influenza A. Also, influenza is a seasonal, so it is very easy to infect it, especially winter times. And this is the influenza prevalence statistics coming from the US, since the US have the most well reported network system, so their reporting system is quite reliable. As you may see, death, hospitalized, and illness is showing here. And the height and the width means that height means number, or area means number, and width is the spreading period. So depending on season, the area, which is the infected person, is different every year. Before 2010, there's a very famous avian flu has been hit the world, and the lots of people has been impacted, and especially 2017 to 18, we have been high peak of the patient. Normally, around the 10-year cycle is reported that pandemic or severe flu situations. There's a similarity and difference in COVID-19. The similarity can be found with mostly 2 things. One is the infection route, which is the aerosol, and second is the symptoms. Normally, if you have infected flu or COVID-19, you will have the fever, coughing, breath difficulties, fatigue, muscle pain, headache, and fever and vomiting and diarrhea in the children. Meanwhile, the COVID-19, in these cases, we have been reported that the loss of the smell or taste have been reported, and the COVID-19 cases, that the spreading speed is much higher. So that is the spreading number. Normally, influenza is around 2 or 3. So it means that 1 person can infect 2 or 3 persons. Meanwhile, COVID-19, initially it thought to be around 5, but afterward it is known that the spreading number is the 5 to 7, which means that 1 person can infect 5 to 7 persons, which means it is around more than 3 times more infectious compared to flu. For example, if you think about the measles, which is one of the most widespreading virus and high spreading number, the number of the spreading is around 10 to 15. So compare these cases, you will just figure out how spreading speed is different in these diseases: flu, COVID-19, and measles. So in case of the influenza, there are 4 different types of diagnosis available, which is the PCR and FIA and gold rapid test with a device reading, and just rapid test judged by the human eye. So it has all pros and cons, and especially PCR is a very sensitive and confirmatory test in case of the COVID-19, but it is very complex and need to be well-equipped facilities and well-trained person to operate. Otherwise, you're giving the false positive and false negative. Right? Meanwhile, the FI method, fluorescence-based immunoassay, is a very high sensitivity compared to the other tests other than PCR. Sometimes the FIA method, such as the Sophia device of the Kydell or Boditech flu test, is around 90 to 95% of sensitivity compared to the PCR. And in case of the gold test with the rapid reader, the sensitivity is around 70%. And rapid test cases, it is sensitive up to 75%, but most cases, the sensitivity is the 40 to 60%, which is far less than what we need for the COVID-19 antigen test. So we have been improved or combined 2 tests with the COVID-19 and flu A/B test. As you may see, in our combo test, the sample is the nasopharyngeal swab or oropharyngeal swab, and sample volume is the less than 50 microliter of the body fluid. And cutoff, we use just the 1 as a standard value, and it is calculated based on the population study. And test time for the combo test is 20 minutes, slightly longer than current antigen test. And shelf life is the same as the antigen test, 20 months at the room temperature, and reference device is the RT-PCR. In terms of the sensitivity and specificity, we have used 148 flu A and flu B together with the COVID-19. In this evaluation, iChroma giving 100% specificity for flu A and B, and COVID-19 giving 98.3% of the specificity. Sensitivity in case of the COVID-19 was 100%, and flu A and B giving 93.8%. It is much better than current COVID-19 antigen test, especially the COVID-19 sensitivity and specificity. For RPS, everything is same, but RPS, you know that it's all-in-one cartridge, and it is automated one. But sensitivity and specificity wise, it's just slightly different and basically same. For specificity, all COVID-19 flu A and B is giving 100% of the specificity. And in terms of sensitivity, 96.8% for COVID-19 and flu A, and flu B is the 93.8%, which is the one sample difference between the iChroma and RPS, which we can say that is the basically it is same. The procedure for the antigen, procedure for the COVID antigen flu combo test is the same as the COVID-19 antigen test. Only difference is that it needs to be incubated 20 minutes rather than 12 minutes. And in case of the COVID-19 combo test, is the same procedure as the COVID-19 antigen. And as I mentioned, incubation time is 20 minutes. This is the evaluation, clinical evaluation result is summarized in terms of that area under the curve. in this curve, you can see that this lower right side means that it's bad performance, and upper left side, it means that good performance. So all COVID-19 antigen tests, in this case is just for the flu, COVID-19, and flu A and flu B is the one by one. You see that COVID-19, flu A, and flu B. So it's three different clinical situation is separated in three graphs. As you may see, the all has been very great performance, the same as the RPS. So you can expect the same performance in this COVID-19 flu and influenza combo test. So I just mentioned for some competitive product. Competitive product is still, they said, it's a combo test. But in terms of the real combo test using one cartridge, only Kidesopia is using one cartridge, but other competitor like Humasis and Gembody, they're using two cartridges. So actually, it's just not real meaning of the combo test. Just they have the double test in the one cartridge. So while our Boditech test and the Sophia Kaider test is the advantage over this product. And it's, when you tested COVID-19 flu or flu B, you want to check with the PCR. We do not recommend using the BTM or UTM for the PCR test. Since the BTM, UTM, we need to mix with the equal volume of our EV buffer. So it will dilute it and it will lose the sensitivity. So what we recommend is after extracting the swab, you can take 100 microliter or 50 microliter for the PCR. Our EV buffer is compatible with the PCR and also compatible with the DNA or RNA extraction procedures. So you know that it's the reader specification, ICHROMA 2 and APIAS 1 and APIAS 6. So this up to 30 to 40 tests per hours is based on our antigen test. So it will slightly less than this performance. In case of the APIAS 6, you can test around 20 tests to 18 tests per hours. And APIAS 1 is 3 tests per hours. And ICHROMA 2, 20 to 30 tests per hours. And we also have been selling other COVID-19 related items. So 3 items is related COVID-19 related infections. CRP is the inflammatory marker. It can be used for the initial stage, how COVID-19 is the serious or inflammatory it has been affected. The second thing is the PCT and ferritin. In these cases, as you may know, once you infected COVID-19, some people get sick and the phenotype or the clinical symptom is the same as the pneumonia. But in case you have been infected the bacteria, the symptom quite similar. So most of the severe patients will recover from the COVID-19. And at that stage, if they infected in hospital and caused some pneumonia, it cannot be easily distinguished from the COVID-19 or second infection. So in these cases, you need to check the second infection with the PCT or ferritin to check out that the recovery stage patient is infected or not. And the other item is the D-dimer. Actually, D-dimer is the can be used for the cardiac-related issues or thrombosis, which is the clotting of the blood in the vein. However, it is known that COVID-19 patient blood clotting in the vein can happen. So depending on how seriously affected or how much thrombosis happen in the blood, you need monitoring. Otherwise, the thrombosis will affect the cardiac and cause the cardiac problem. And last item is the IL-6, which is the launch this year. IL-6 is one of the cytokine and it is a main biomarker and cause of the inflammation. So when the COVID-19 patient tested IL-6, if the IL-6 level is high, for example, 37 nanogram per milliliter, means that the chance of their prognosis or the patient getting severe COVID-19. So in the initial stage, you can classify or clinical management can be rely on the prognosis markers such as IL-6. So this is the currently our product line for the COVID-19 together with the COVID-19 antigen and COVID-19 antibody. Also, we are preparing another product under development. The one product is the neutralizing antibody. So neutralizing antibody means that the antibody happen or produced in the body after recovering from the COVID-19, which antibody is the specific function. What it do is that it will inhibit the binding of virus protein to the cell surface receptor, which means that virus can impact through the surface receptor so-called ACE2. If it is blocked by the neutralizing antibody, then virus cannot enter the cell inside and it will not reproduce. That means that even though virus are introduced in your body, it will not infect your cell and it will not amplify inside of your body. So neutralizing antibody is the functional antibody causing or preventing virus binding to the cell or virus infection of the cell inside. So neutralizing antibody can tell three things. One is that you can check covalence or recover the patient if he has the neutralizing antibody. It is reported in most of cases recovered patient have the neutralizing antibody, but some cases neutralizing antibody is still missing, so they are exposed to the second infection. And second thing is that the test of the vaccination effect after injection. Normally, in case of the flu, we do not test the vaccine is effective or not, but flu is just a vaccine and treatment and test is available. So you can just get vaccination, and if you affected seriously, you can get the medicine such as the remdesivir, such as the Tamiflu, but COVID-19 is very serious disease, so you need to check it out if that vaccination is effective or not. So to that purpose, it can be used. Also, sometimes when you travel to the other country or other regions, you may need to prove yourself you have been vaccinated, but it is not easy. In these cases, you can check the neutralizing antibody test. Once you have been vaccinated and effectively get the immune, then your neutralizing antibody test will give the positive result, which means that you have been immune or you are not seriously get sick with the COVID-19. So there are some kind of controversies, but we are not sure because of the vaccine is the new one. It will completely block the virus infection, or it will allow the infection but soothing the severity, so which means that once you have vaccinated, you may not get COVID-19 or you may get COVID-19 with the mild symptoms. And third thing is that validation of sustained vaccination effect. It means that currently there are reports that second infection cases, most of disease, if you once you have been sick and recover, the antibody will raise against it and it will prevent a second infection. However, the COVID-19 is reported that after 4 months they have been infected in the first time, the second infection happened, which means that some person even though they are sick from the COVID-19, they can infect the second time. That means that their neutralizing antibody in the body has been disappeared and cannot protect your body anymore. So to validate sustained vaccine efficacy, you may need to check the neutralizing antibody test. So I'm showing the two different formats of the test. One is the ELISA format in the right side. One is our test format in the single test. Currently, Boditech had almost finished the development of the COVID-19 neutralizing antibody test with the GeneScript. The GeneScript is the multinational company which got the neutralizing antibody FDA EUA at November. So we are communicating each other and share the technologies, and we are finalizing the neutralizing antibody test in the RPS and iChroma. We're expecting that the product will be finished in December and launch the market at January of the 2001. So this is the my presentation, and I will get the question from people. So we have 57%. If somebody is talking, it will be very busy and hard to handle it. So please write down your question in the chatting windows. I already have several questions in the chatting windows. I will read one question one by one and get the answers. First one is that, do you have study about the PCT that is the indicator of the second infection of the COVID-19? Actually, we do not have direct test in our company, but we have reported with several hospitals in Korea that they are checking the PCT for monitoring the second infection by bacteria. And other test is the ferritin. It will be also giving the similar result, the second infection. And second question is the combo test CE certified and it is QC available? Yes, the combo test is the CE certified and QC is available. You can ask that from your regional managers. And next question is the what other test in the same category which an indication of the second infection of the COVID-19. Normally, you can use the CRP, PCT, and ferritin. In this cases, PCT is just the indication of the bacterial infection, of the CRP and ferritin can monitor for bacteria or virus infection. So it may cause by the second infection, or it may be reappearing of the or worsening the symptom of the COVID-19. But in the clinical situation, you can judge with depending on the other clinical markers or symptoms. And other question is that, is the RPS combo test for the COVID-19 flu available now, and when it will be launched? We expecting launch at December. Currently, we are finishing the Korean registration, the export registration, free sales certificate, and I think that it will be finished by next week, and we can start the shipping on second or third week of the December. And also the test for research use only, for the test evaluation purpose, the combo can be shipped. So just contact your local manager to have a test kit for the evaluation purpose. And other question, can we transport sample after collecting? Yes, of course. In some countries, the collection site and testing size is different. So we're providing a lead cap to tighten that the filter. Once you have the extraction with the swab with our EB tube, you can get the cap tube nozzle and tighten the lead cap to prevent the leaking of the sample. Then you can transport it. And next question is that, Do the sensitivity value and specificity numbers you presenting correspond exact what is written in the package insert of the test? Yes, it is the official evaluation on the monitoring of the Korean government. So it will be right down on the IFU or insert. So I will go to the next question. Would you explain again how the extraction tube can be used at the same time for the PCR testing? It is validated for the several brands. Yes, we have been tested in several extraction. We're using 2 or 3 different extraction. After extraction, the component is the compatible to all the PCR, in general common PCR. And as I mentioned in the picture, you can take the 100 microliter from here, or you can use around 2 to 4 drops. Normally 2 to 4 drops is around 50 to 100 microliter. So you can use it for the PCR purpose. And next question is that how important the ferritin parameter for COVID-19 disease? So ferritin is not specific for the COVID-19. Ferritin is elevated when in the blood when it is impacted by bacteria or fungus, any kind of inflammatory agent. So it is general marker for the infection, so you can use it. However, PCT or CRP can do that at the same time, or replacing of the ferritin, so you can use CRP ferritin or PCT for the testings. And next question is that, is there a possibility of developing other neutralizing antibody tests for other immunizable disease, for example, yellow fever? Yes, it is possible in general, but the thing is that we need to check it out. What is the disease? For example, hepatitis A or B can be used, but in case of the yellow fever, it is classified as the dengue and other chikungunya. It is so-called the flavivirus family. So it may have the cross-reactivity. So we need to test it. Otherwise, we cannot guarantee for the yellow fever. However, theoretically, it is possible. And we already have been working to antibody test with the dengue, and we can develop within flavivirus neutralizing antibody, but however, it will take a time. And next question is that, is there quality control material available from ICROMA COVID flu test? Yes, we will provide the control material. In this cases, we need to provide the 3 different control material: the COVID-19 antigen, COVID-19 control material, flu A control material, and flu B control material separately. So do you have any other questions? For your reference, I will circulate this presentation material, and you will get the copy of the presentation material from your regional managers. I have another question from here. When the neutralizing antibody test will be available? So we almost finished that development, and at December we will finalize product and apply for Korean FDA. And I think that end of the January 2001, which is around 2 months ahead, it will be available. And other question is that, is it usable only for ensure that vaccine is efficient? No, actually it can be used generally for patient recovered from the COVID-19, which he have the neutralizing antibody or not, or validation for how long it does take to disappearing the neutralizing from the patient. So it can be used for the general purpose, but one thing is the sure, if neutralizing antibody positive means that he has immunity against COVID-19. However, the vaccination trial is the start point. So we do not know, as a few days ago, Moderna CEO said that even though Moderna vaccine is the widespread, we are not sure to spreading of the virus because some vaccine will prevent is the initiation of the virus infection and shut down the disease and will not spread that impacted person. But some vaccine is the weak. In the cases, he will impact it and then impact other person, but the symptom will be very mild and not going to be a severe status and will recover most of cases. So neutralizing antibody can be tested for immunity, but it will not guarantee that you are not supposed to infect against the COVID-19. So other question is, are there quality control material and calibratable for RPR6 and COVID-19? Yes, we're selling antigen, one set, negative and positive set for COVID-19 antigen test. And also antibody test is available. But the thing is that we have very limited amount of the antibody test control materials available. Since that the control material is coming from the blood of the recovered patient, so we select by our criteria and make the control material, but it is very hard to get right tighter patient blood, so we have only limited amount is available. And so we cannot use the UTM, VTM at all. It is compatible, but it is said it's the compatible, but it will affect the sensitivity. Let's do a very simple calculation. Our extraction buffer is around 450 microliter. Meanwhile, the UTM VTM is normally 2 to 3 ml. And to use the UTM VTM to our test, it needs to be mixed 1-to-1 ratio with our EB buffer. Means that you need the 450 microliter of VTM will mix to our EB buffer and drop it. So it already have the 2-time dilution in mixing with the UTM and VTM. And together, what we recommending is just concentration, but UTM VTM is already 2 to 3 ml, which is around that 5 to 7 times of the volume. So easy calculation, at least a 10-fold dilution of the sample means that 10-fold less virus will be detected when you're using the UTM VTM. So it will drop the sensitivity. So what we recommend for testing is to use just the swab extract using our EB buffer. And when you need a PCR, just use our EB buffer. You can also mix our EB buffer to the PCR buffer, but our recommendation is direct extraction from our EB buffer. So there is the questions. When do you expect to have the CE marking for COVID-19 antigen flu combo? I think that before, I think it's already CE marked, so you don't worry about that. We are finalizing CE, just the self-doc, so it will be finished by end of next week. And for the COVID-19 neutralizing antibody, we will finish it up an evaluation by end of December, and we will get a CE early January. Is there a new PS firmware update necessary using combo? No, actually, when we developed our firmware, we already decided to develop the combo test, so there's no firmware update is required. However, in case they have something reported, we may need to update the software, but currently the software is already compatible with the combo test. Okay, so if you don't have any questions, I will just close this section. You can email to me or your regional managers the additional question related to this webinar. There is one more question. Is the comfort test need to update for the iChroma 2? No, same as the AFIA. So we already plan to develop this combo test. So the current software having the combo test functionality. Okay, thank you very much. And I will finish. Okay, so is it possible to get the COI for the combo test? No, COI is not available because that COI in the antibody test is the clinical meaning, but antigen and combo test, it will make more confusion. Yes, I will share this presentation to local manager. So please contact your local manager or CATIA to get this presentation. Thank you very much. Bye-bye. Have a good day.
Goodbye.